Digoxin is one of the high-yield drugs for testing. What are the brand names of digoxin in the U.S.? The three are Digitek, Digox, and Lanoxin. What are the pharmacologic categories of digoxin? Digoxin is an anti-arrhythmic agent and a cardiac glycoside. What are the uses of digoxin? Digoxin is used primarily for heart failure in patients who have a reduced ejection fraction. It is appropriate for the treatment of mild to moderate heart failure in adults to increase myocardial contractility. It can also be used in pediatric patients with heart failure. The other important use of digoxin is in atrial fibrillation, atrial flutter, for rate control. This allows for the ventricular rate or the heart rate to be controlled in patients with chronic atrial fibrillation. There are additional uses of digoxin referred to as off-label uses. This includes fetal supraventricular tachycardia and supraventricular tachycardia or rate control in adults. What is the mechanism of action of digoxin? Digoxin improves heart failure by inhibiting the sodium-potassium ATPase pump in myocardial cells. This ultimately results in an influx of calcium into the myocardial cell and increases contractility. Digoxin toxicity in adults and in pediatric patients can occur with digoxin levels greater than 2 nanograms per mil. However, due to the narrow therapeutic window of digoxin, toxicity may result even at therapeutic levels. Hypokalemia may be a significant factor. The symptoms of digoxin toxicity are nausea, vomiting, visual disturbances which may include halos or yellow vision or blurred vision. Lethargy may be a side effect of digoxin toxicity as well as life-threatening arrhythmias. What arrhythmias do we see with digoxin toxicity? Well, they include atrial tachycardia, AV block of all types, first degree, second degree, and complete heart block. We may even see premature ventricular contractions. In severe cases, we may see ventricular tachycardia or ventricular fibrillation. Is digoxin toxicity reversible? The answer is yes. Digoxin toxicity is reversible when the drug is discontinued and with the administration of digoxin immune FAB. We associate a number of risk factors with digoxin toxicity, and they include a digoxin concentration greater than 2 nanograms per mil. Risk factors include age, including older adults, chronic obstructive pulmonary disease or COPD, hypothyroidism, electrolyte disturbances, hypokalemia, hypomagnesemia, dehydration, and low body weight. There are some medications that may affect digoxin and increase the concentration, resulting in an increased risk of toxicity. These medications include verapamil, quinidine, amiodarone, and erythromycin, to name a few. What are the additional adverse reactions that we may be asked? They include prolonged PR interval on EKG and premature ventricular contractions. Rashes, including maculopapular and papular rashes. Gynecomastia, we already have discussed abdominal pain. This includes anorexia and diarrhea and vomiting. Thrombocytopenia, altered mental status, including confusion, delirium, depression, and hallucinations. Headaches and lethargy may occur as well. Neuromuscular or skeletal adverse effects include asthenia. Contraindications include any hypersensitivity to digoxin or any component of the formulation. An additional contraindication is documented ventricular fibrillation. What are the drug interactions? The drug interactions of digoxin are many, and these should be considered before prescribing. What are digoxin considerations in pregnancy or breastfeeding? It is important to remember that digoxin does cross the placenta, and digoxin is found in the breast milk. What are the dietary considerations of digoxin? Primarily, the dietary consideration includes encouraging patients to consume diets with adequate amounts of potassium to decrease the risk of hypokalemia. Hypokalemia is a well-documented cause that increases the risk of digoxin toxicity. What are the monitoring parameters of digoxin? We monitor heart rate and rhythm. In addition, periodic EKG should be done to assess the effects of toxicity. Baseline and periodic labs, including creatinine, serum potassium, magnesium, and calcium, especially on patients who are taking diuretics. Patients should be observed for non-cardiac signs of toxicity, including confusion and depression. When should we draw digoxin levels? Digoxin levels should be drawn because digoxin has a narrow therapeutic range. Digoxin serum concentrations should be drawn optimally at 12 to 24 hours after each dose, but they should at least be drawn 6 to 8 hours after the last dose. Other factors that affect serum digoxin concentration is exercise. So a period of rest, at least 2 to 3 hours after exercise, should be allowed before drawing serum digoxin levels. What is the reference range of digoxin? The digoxin therapeutic serum concentration level in adults is 0.8 to 2 nanograms per ml. Question. The nurse is providing discharge instructions for the parents of a 2-year-old infant who is receiving digoxin after cardiac surgery. What information is important to relay? Select all that apply. A. Mix the medication with orange juice. B. Give a second dose one time if the child vomits. C. Give the medication at the same time every day. D. Notify the healthcare provider if the child has persistent vomiting. E. Administer a missed dose as soon as possible. F. Notify the healthcare provider if more than one dose is missed for any reason. The correct answer is C and D. Explanation. Digoxin should be given at the same time every day, usually every 12 hours. Gastrointestinal upset, nausea, and vomiting may be signs of toxicity. The healthcare provider should be notified of more than 2 missed doses. This may affect therapeutic levels. Digoxin should not be crushed or mixed with other fluids. Question. In a patient who has been taking digoxin for congestive heart failure, what lab finding may cause a significant risk of digoxin toxicity to the patient if left untreated? A. Hyperkalemia. B. Hypokalemia. C. Hyponatremia. D. Hypernatremia. The correct answer is B. Hypokalemia. Explanation. Hypokalemia is a common cause of digoxin toxicity. Potassium levels must be monitored in patients taking digoxin to avoid toxicity. Serum sodium levels are not a significant cause of digoxin toxicity. Question. The healthcare provider prescribed warfarin in a patient with deep vein thrombosis. The nurse instructs the client to avoid using which over-the-counter medication while taking warfarin? A. Aspirin. B. Digoxin. C. Furosemide. D. Guaifenesin. The correct answer is A. Aspirin. Explanation. Aspirin is an antiplatelet medication that is contraindicated while taking warfarin because it will increase the drug's anticoagulant effects. Digoxin, furosemide, and guaifenesin do not affect blood coagulation. Digoxin and furosemide are not over-the-counter medications. These medications require a prescription. Question. A patient with atrial fibrillation is being discharged on digoxin. What statements by the patient indicate the patient understands the teaching? A. I may experience rash over the palms and soles of my feet. B. Increased appetite is a sign of digoxin toxicity. C. I will contact the healthcare provider if I have visual disturbances such as seeing yellow halos. D. I will contact the healthcare provider if I have diarrhea. The correct answer is C. I will contact the healthcare provider if I have visual disturbances such as seeing yellow halos, and D. I will contact the healthcare provider if I have diarrhea. Explanation. Visual disturbances such as blurred vision and yellow halos are symptoms of digoxin toxicity. Other symptoms of digoxin toxicity include abdominal pain, diarrhea, and vomiting. Patients may experience bradycardia and other arrhythmias. The type of rash described in A and increased appetite would not be expected with digoxin toxicity. Question. An outpatient receiving digoxin and hydrochlorothiazide was recently started on 2 new medications, enalapril and Vicodin, postoperatively. The patient calls saying he is experiencing mild tightness in his throat. What is the appropriate action for the nurse to take at this time? A. Check a digoxin level to assess for toxicity. B. Record the information in the medical record. Tell the patient to rest for 1 hour and call back in 2 hours. C. Ask the client to discontinue the hydrochlorothiazide immediately. D. Tell the patient that he should be evaluated immediately in the emergency department and notify the healthcare provider. The correct answer is D. Tell the patient that he should be evaluated immediately in the emergency department and notify the healthcare provider. Explanation. The nurse should recognize the tightness in the throat as a possible adverse reaction to enalapril, an ACE inhibitor. This is not a symptom of digoxin toxicity. Angioedema from enalapril may be life-threatening and lead to airway obstruction.